In the last class, I started discussing psychoanalytic therapy and began with what are the goals of psychoanalysis, and then in that context, I discussed that the main goal is to bring the unconscious factors, unconscious dynamics that are leading to psychopathological symptoms into the consciousness. And as you can see on the slide, that Corey in his book also says the same thing, that first goal of psychoanalysis is to make the unconscious dynamics of behavior conscious. But he adds that there is another goal of psychoanalytic therapy, that is to strengthen ego so that behavior is based more on reality and less on the instinctual cravings, the instincts of the id. A similar classification was given by Nelson Jones. This is another author of a good book in counseling and psychotherapy. He said three things, that psychoanalytic therapy aims at three things. First is, as you can read there, that it makes the id less restricted, because id is instinctual in nature. Its desires and needs are animalistic, socially not sanctioned. So it is always being restricted by ego and superego, because if all the id impulses will be enacted by the individual, it will create a lot of punishment and harm for the individual. Therefore, the ego, superego always try to balance. In this process, the patient's id become very restricted. Therefore, the therapist aim is to make that restricted id less restricted. And then, as Corey has said, the second is to make the weakened ego, the ego which is fighting throughout the day and night with the id impulses, becomes weak. So, to make the ego more strong is another goal that I have discussed in the class, so I will not detail it in the last class. And the third goal that he added is that the superego, which is having, you can call it a bundle of rules guiding moral principles. So it is the principle of morality. What is right and what is wrong is decided by one aspect of our personality or mind, that is called superego. And this superego is always punitive. It always says that if you will do this, you will get this punishment. So that punitive superego should be made more humane in nature. This is the three goals as described by Nelson and Jones. Now the question is, and as I said, that without attaining the first and foremost goal, that is without bringing the unconscious, because unconscious is outside of awareness for both parties, the therapist as well as client. So until and unless the unconscious material will come in the conscious surface, we cannot work on it. So this is the foremost, most important goal. Now, how this psychoanalytic therapy brings cure? This is addition. This was not discussed in the last class. So if I ask this question, what brings cure in psychoanalysis? One answer, the more general answer will be that it brings cure by restructuring the personality. Because if you will remember my earlier classes, that according to psychoanalytic, there are three structures of personality: id, ego and superego. Id is more restricted in patients. Ego has become disorganized, not functioning well, and superego is more punitive rather than human. When you will do psychoanalytic therapy, an order will be restored in the ego. Therefore, what will happen? The otherwise disorganized personality will be organized. So basically it is restructuring the personality. Then you should ask, sir, what aspect will be restructured, though I have answered briefly, but I will cite here Freud himself. And as I have read this in the book Nelson Jones, according to Freud, the restructuring largely occurs in terms of restructuring the ego. Though in terms of psychoanalytic therapy goal, I mentioned ego, id and superego. You can see there. The first thing is that it stimulates the client's ego. So when the client's ego is stimulated, strengthened, what will happen? It will be capable to struggle against its demand. And with the strength that ego has gained during the therapy process, what will happen? It will be able to defeat the resistances arising in connection with the inevitable conflicts that are going on within the individual. Second, what Freud said, that restoring order into the client's ego, that I have already said. And third is to train the psychoanalysts, the client's weakened ego to participate in the intellectual work of interpretation. In last class, I discussed that bringing the unconscious materials into the conscious itself will not be sufficient to bring cure. One intellectual work that is called interpretation, and it is a technique, it is a part of therapy, that interpretation is done. And what is interpretation in brief? It is explaining the client and making him or her realize that my behavior, whether normal or abnormal, was largely governed by the otherwise unknown unconscious factors that have emerged in the therapy session. So to participate in this intellectual work of interpretation, the ego must be trained, it must be strengthened. And I said that all the cognitive and executive functions are executed by which part of personality? Ego. So ego must be strengthened. This is not my saying, this is the thought of the psychoanalyst Freud himself, as cited by Nelson Jones. So it is clear. So how it brings cure? The simple answer is that my personality, the disorganized personality, will be restructured and it will become more organized. But how, where this organization will take place? At the level of ego. We will be restoring order in the ego, we will be stimulating the ego to struggle against the id, and finally we will be strengthening the ego to participate in the intellectual work of interpretation. Now, as I said, that when you will go to most of the books learning what is psychoanalytic therapy and what are the steps, for example, when you will go and learn what is systematic desensitization, you will find consistently that there are 3 steps, but they are not hierarchically organized 3 steps. The first, you will read that training into relaxation or making the patient feel relaxed, then creating a hierarchy of anxiety provoking situations, and then finally combining this relaxed state with the anxiety provoking situation. But it is not done in this particular sequence. Similarly, if I ask what is the step of the psychoanalytic process, then you might have thought something. If it is coming to your mind, you have not to say, I will not ask. So what will be the step of psychoanalytic therapy? So basically there will be 2 steps if you have clearly understood the goals and process of psychoanalytic therapy. One step is given here in red font and the another is in blue font. The first part of the psychoanalytic therapy is to use those techniques, those tools, those methods, those processes that will help to bring unconscious determinant of the psychopathological symptoms into the conscious mind, into the therapy session, so that both therapist and clients become aware of the unconscious dynamics. Once we have learned what are the unconscious factors that were leading to the psychopathological symptoms, then the second part is to help the patient to develop insight into the unconscious dynamic of the behavior. And interpretation is the tool and technique. I will mention the tools and techniques also in coming points. So, in psychoanalysis, what is done? Using therapeutic methods and techniques, first we bring the unconscious material into the conscious. The early childhood experiences that were linked with oral, anal and phallic stage, all those unconscious conflicts associated with the early childhood experiences are also discussed in the therapy session. Why? To know the unconscious dynamics. And these unconscious factors, materials are then analyzed, discussed and interpreted. And whenever needed, they are reconstructed so that the client is able to assimilate it, accept it and understand it. Otherwise, if I will say directly that look, you are showing this behavior in the classroom because this is the unconscious conflict about which you are not aware, you will laugh and you may not accept it. So this is the step. So broadly we can classify the psychoanalytic therapy and treatment, and in most of the book it is not organized in this way. You will find it will start number 1 free association, number 2 dream analysis, number 3 analysis of resistance, number 4 like that. But I am trying to bring the order so that you can understand why we do free association, why we do dream analysis. So those techniques that are used to bring out unconscious material in the therapy session, that is one set, and that includes free association, dream analysis, and there are two techniques, confrontation and clarification. When you will do free association, it is not that free. Patient always show a resistance, they will halt. When you will say, you say all the things that are coming to your mind in any order without censoring, whatever, without thinking what is good or bad. This is free association. But you will find, if you will really do that, after saying a few things he will stop. If he stops, then it means he is showing some resistance. To overcome those resistance, we use another technique or set of techniques called confrontation and clarification. So all these techniques are when we make the patient confront, when we clarify that you are showing resistance, then he again starts free association. So all these techniques are doing one and one thing, helping us in one and one way to bring the unconscious dynamics, unconscious factors at the conscious surface. And there are another set of techniques, because it is not that if you will bring the unconscious into the conscious, it will heal the patient. No, it creates a lots of problem. When I will proceed through the therapy, you will find a stage that is called transference neurosis. When all the unconscious matters comes into the consciousness, the patient become more ill. He shows more severe symptoms because now he is aware of all those things. His ego is threatened. Otherwise he was suppressing all the impulses. So the second part is the therapeutic part that really brings cure, and that includes two techniques. One is interpretation that brings insight. So I will define what is insight in psychoanalysis when time will come. But insight is developed about the unconscious dynamics of the behavior. By what technique? By interpretation. And then the client is trained to work again and again, practice by himself or herself. Sometimes psychotherapist will help, and here in psychoanalysis the psychotherapist is called analyst and the client is called analysant. So analyst will help to some extent, and gradually he will start taking away the help and leave the patient to interpret himself, to develop the insight and work with the insight. That is called, this is the longest process in the psychoanalytic therapy, and by working through means working again and again with the insight and interpretation that has been developed in the therapy session. Ultimately the patient learns, knows, okay, I was behaving in this abnormal way because of my unconscious factors and reasons. Clear? But this is the theoretical classification. When actually we will do, it will not be in this two step. So broadly the steps can be, and again this organization, though I have read, discussed with psychoanalysis practitioners and then organized this, so it is not my own creation, but I have created that the whole therapy process can be divided into 3 phases. But before this 3 phase, there is one pre-therapy phase also. So I will discuss that. And what is that pre-therapy phase? That is the pre-therapy evaluation. First, as a psychoanalyst, we will have to evaluate whether this client is suitable for psychoanalysis or not. All the clients are not good candidate for psychoanalysis. So this is the free therapy assessment or evaluation. What Greenson has said, who are not suitable, we should know, then we can evaluate. Greenson, and this I have cited from a very good book on psychotherapy, and I will definitely recommend you to go through that. That is written by Prosaska, and we have a copy in the library. And for psychoanalytic therapy, that is good book. So people who do not dare regress from reality, actually when unconscious materials will start bubbling up, when childhood experiences will come in the conscious, then what will happen? We will regress to the childhood, and that will be more painful and traumatic because we are threatened by those impulses in our early childhood. So those who are not having the courage to regress cannot be a good candidate for psychoanalysis. Those who cannot readily return readily to reality. So if you are not able to understand the principles of reality, they are also, and who are, I will mention. So 2 things: those who cannot regress, not have the courage to regress, and those who cannot readily return to the reality are not good candidate for psychoanalysis. So patients with psychosis in general, schizophrenia, manic depressive, schizoid, borderline personality disorders, they are not good candidate for psychoanalytic therapy. And similarly, any patient having limited verbal and intellectual capacity are also poor rest for psychoanalysis. Just think and try to answer, though you have very good thing that you have not to speak. So try to answer this. Who are the persons having limited verbal and intellectual capacity? Only those, we will have to name them. So the child and early adolescents may not be good candidate because they are just growing. The mentally retarded, mentally challenged person, intellectually challenged person may not be good candidate for psychoanalysis. Why? Because of the limited verbal and intellectual capacity, they will not be able to participate in the intellectual work of interpretation. Okay? So before we follow, though I am going to say what are the three phases, we do the therapy in three phases, but the one phase is more important. First decide whether we should admit for psychoanalysis or not. Clear? So, after making the decision, suppose we have decided that yes, the patient should be entered into the therapy session. He is good for psychoanalytic therapy. Then, the first phase is using all those tools and techniques that will help to bring the unconscious factors, unconscious mechanism, unconscious dynamics into the consciousness. Rather than seeing me, better to see the slides also. Okay? You actively listen me and see. So, in the first phase, the main aim is bringing the unconscious material to the surface, and in the therapy session also. Suppose it comes to my conscious mind and I do not share all these things in the therapy session, the therapist will not be aware of that. And until and unless therapist is not aware, she cannot help. So, when I am saying making unconscious conscious, it means conscious to both the analyst and the analysant. And then free association and dream analysis are the techniques used in first stage. And as I said earlier, today in this class itself, that free association is not that free. Resistances, defenses will occur. The client will not be able to freely associate. Then during this phase, identifying those resistances, and I will teach you what are the resistances and how to identify them, how to handle them. I will teach you. So, to identify those resistances and try to overcome them is also the part of the first phase. And then using confrontation and clarification for what? Again, to facilitate the bubbling up of the unconscious materials to the conscious plane. So, free association, dream analysis that you might have learnt earlier in the book, confrontation and clarification, I think you might not have learnt or came across this because the most popular common books do not discuss this. But all these techniques are used to bring the unconscious into the conscious, and that is the first phase. But when we, during the first phase, we are dealing with resistances also. So when the resistances are lowered, when the patient is able to overcome the resistance, then what will happen? Just assume without reading and distracting yourself. If resistance will be lowered, and why resistance is occurring? Because my ego, which is conscious, is saying no, if it will come, it will be harmful for me. It will defame me. It will again create the same threat. This is the cause of resistance. So when resistance will be lowered, what will happen? The more deep-seated unconscious materials will start coming up. So I have highlighted in blue font that the focus of the second phase is to bring out the deeper unconscious materials, and especially those related with the oral, anal and phallic stage. That is to bringing up the unconscious material associated with early childhood experiences. This is the major goal of the second phase. And how it is done? One thing is called maintaining analytic framework that I will teach today if time will permit, and I do hope that time will permit. Okay? So, maintaining or holding the analytic framework and maintaining an attitude of neutrality and ambiguity from the side of analyst helps the client, it facilitates the clients to share the deeper unconscious materials into the therapy session. So, the analytic framework plus lowering of the resistance results in regression. So, as the resistances will start going down, overcoming, then deeper unconscious childhood experiences will be coming, and then we will start regressing to the childhood experiences. We will be starting to act as we acted during our early childhood. That I have already shared while discussing the theories of psychopathology. So what happens that when patient regress into the childhood experience and starts bringing out deep-seated unconscious material, what happens? That ultimately this process, when it continues for a longer time, it results in a type of reaction that is called transference. And what is transference? The analysand projects his or her feelings on the therapist. So projection of the feelings of the client on the therapist is called transference. And if it happens otherwise, say I am analyst and you are client analysand, and I starts projecting my feelings, thoughts, ideas on you, then that is called counter transference. So I will discuss when transference will be discussed. So what happens in second phase, and that is the ultimate goal. If you have not been able to create this transference reaction, then you have not been successful. You have not crossed the second phase. So your success of second phase is that transference should occur. And when transference reaction is further catalyzed, and how it is catalyzed, I will tell you when I will teach transference. There are 4-5 points and techniques that therapist or analyst used to catalyze the transference. When transference is catalyzed, what happens? That transference reactions take the shape of transference neurosis. And transference neurosis is basically enacting of the full-fledged psychopathology, showing all the pathological symptoms into the therapy session itself. Okay? But remember that while teaching I said that one part is bringing unconscious in the conscious, another part is doing interpretation, but it is not that categorized. Okay? Interpretation may also be offered, not in the first phase, remember. In second phase, sometimes the analyst may offer interpretation, okay, to develop insight into the unconscious mechanism. So, the pre-work for the third phase, and third phase is basically doing interpretation, begins in the second phase. So, when transference neurosis occurs, not all interpretation, we just what we will say, we just prepare the client for accepting interpretation. So some interpretations are offered in the second phase. And finally the third phase of therapy, that is all are important, equally important. Like two wheels are required for our bicycle and bike. Any wheel, if it will be removed, we cannot move. It is something like that. So I cannot say that this is the most important. All are equally important. In third phase, as I said earlier, that developing insight through the work of interpretation is done, and working again and again with the same insight, that is called working through. the client develops insight into the unconscious factors and mechanisms, and therapy or cure occurs. Okay, and this last point is that, as I said in my beginning first class when I introduced the meaning of concept of the psychotherapy, that psychotherapy is always given in a network framework of client-therapist relationship. Similarly, throughout the psychoanalysis, one thing will always be present, that is called the maintaining of psychoanalytic framework. That is a particular term I will explain, and I am going to explain just after this slide. So, psychoanalytic framework will always be there, and we provide all these techniques while maintaining psychoanalytic framework. So it is not part of any one phase. Though while discussing, I might have discussed that, for example, in second phase I mentioned that the client has to maintain psychoanalytic framework. It doesn't mean that it is the part of the first phase only. Throughout the psychoanalytic therapy, this analytic framework is required. And remember, we all are learning just through I taught in research methods different ways of knowing. So one way of knowing is knowing from authority. So we are learning it from authority, but real psychoanalytic therapy training requires, and I hope you all know, that this is the only and only therapy, though all therapies will be learned better if it is done in the psychoanalytic way, that to become a certified psychoanalyst, you first must go under the psychoanalytic treatment. So these are the verbal descriptions. I am trying to make you feel that yes, this is the psychoanalysis, but after reading this, we can feel that yes, we can do psychoanalysis, but never try. Why? Because until and unless, why psychoanalysis is required? You might have read in all books it is written that becoming a psychoanalyst requires going through psychoanalysis first. First we have to, because we are also not aware of our own unconscious conflicts, and we all are on a continuum of illness to wellness. So where as a therapist I stand, I don't know, because it is in my unconscious according to the psychoanalytic theory. So each and every analyst must be analyzed first. Okay, remember. तो अभ्यास मत शुरू कीजिएगा. So what is the meaning of maintaining analytic framework? I think today's class will end here, and then I will start teaching the techniques, free association, because I have mentioned all the techniques. So maintaining analytic framework is not any one thing that I can say that you maintain this. It includes a range of procedural as well as stylistic factors. For example, maintaining relative anonymity. You do not disclose yourself as an analyst. Regularity and consistency of meeting. This is the procedural part. Maintaining relative anonymity is stylistic part. As an analyst, I develop a style to remain anonymous for the client. Starting and ending the session in time. All these things will be called together. I will explain the major elements. But such stylistic and procedural aspects taken together is called analytic framework. So we maintain a consistent framework throughout the therapy session. Such consistent framework in psychoanalysis itself is considered therapeutic. If you are not doing anything and if you are maintaining this analytic framework, it will provide some healing, it will work to some extent. Okay? And therefore, the primary duty of the psychoanalyst, if we are labeling us as psychoanalysis, it is our duty to maintain this framework, and therefore we should not depart from these rules and guidelines. So we must be consistently following all the rules and guidelines. Some major components that is there in the analytic framework is related to the analyst's attitude or behavior itself. The first is even hovering attention. This is the technical term used in psychoanalytic literature. And what does it mean? It means that as a psychoanalyst, we must actively and attentively listen to the client without interfering. So, whatever you will say, I will not interpret it, I will not interfere it, I will just listen it. And when I am saying actively listening to the client, then this is not like reading on the line, it is like reading between the lines. So I do not listen only what he or she is saying in the therapy session. I also try to listen, means try to infer what is behind this, what the client is saying in the therapy session. Here I will cite one example and then I will proceed to the next part. And this example you can find in the book. Probably Korchin, the clinical psychology book. There was a client going through psychoanalytic therapy. One day when she came in the psychoanalyst's room, she lied down on the couch. You know the couch. If you don't know, when I will tell free association, I will explain. It is a reclining chair. She reclined on that. The therapist stood behind the client and the session began by free association. Though generally it is not recommended that anything should be on the wall that will create any clue or cue for other types of thought to emerge. But fortunately or unfortunately, in that analyst room, there was a bookshelf in front of the client. So client started saying like this, that today I went to a dentist, I was having much pain in my teeth for a long time. Then the analyst, using the technique of confrontation and clarification, tried, because free association is not telling all these things. You have to share your deeper feelings and thoughts, otherwise unconscious material will never come. Then therapist tried to help her, but again she started saying, and then this problematic tooth was extracted. Then since no order, no sequence, no logic is allowed in free association, after saying this, that the teeth were extracted, she said, and I can see that 2 books in your bookshelves are lying upside down. Then therapist stopped. He said, why you do not directly say that you have got aborted? There was a big halt. And then the client started crying and she narrated all the history and thoughts, feelings associated with the process. What psychoanalyst did here, that extraction equivalent to abortion means bringing something from in to out, and the embryo in the is upside down. So he took 2 clues, and that is not my example, I am referring to the book. You can go and read there. So he was actively listening, and as a psychoanalyst you have to actively listen. And actively listen, I have written that not only the spoken words but also the hidden meanings behind those words. So this is one example of listening behind those words. So reading between the lines, not only on the lines. Okay. So this is one aspect. Second is maintenance of analytic attitude. The basic goal of this, that is maintaining analytic attitude, is to engage the client in exploration and investigation of the inner unconscious world. So if we are maintaining, and how this is maintained, it is written, but you read with me only. If you will read in advance, you will not learn. So you stop reading beyond that what I am saying. So to catalyze or foster the in-depth exploration and investigation of the inner world is the main goal, main mission of maintaining analytic attitude. And how it is done? So the therapist follows the rule of abstinence, which includes, rule of abstinence means avoidance of direct expression of affection and advice. So client, as the therapist, never empathize with the client. He remains neutral. That is one thing which is related to maintaining analytic attitude. Is it clear? So as an analyst, we will not express our feelings. Okay, I am really sorry to hear that you got this and that. No, we will just actively listen. We will help her or him to confront with the resistances and to come with the free association. But we will not share our own feelings. We will not narrate our own story. बहुत से लोग हैं शुरू करते हैं, मेरे साथ भी हुआ था. No. This is one aspect. Second is avoid direct gratification of the needs, because when the unconscious material and unconscious is largely in the it, so when its impulses and wishes and desires will come, it is like a child. It will like that this desire should be gratified immediately. And the client also knows that therapist is like authority figure, like parents. So he or she will expect that this desire should be gratified by the therapist. But we have, as a good psychoanalyst, we have never to gratify the needs. Why? Because of two important reasons. Now you can read. The first thing is that gratification of client's need will reinforce him to be attached with the treatment, to the therapy session itself. I will come and I will get my needs gratified. I will come again. Why? To get my needs gratified. So I will be attached more to the therapy session, therapist, and less to the goal of the psychoanalysis, that is to resolve the inner conflicts. So this is one reason why we should avoid need gratification. And second, when needs will be gratified, it is less likely that the issues underlying the desires, the id wishes, instinctive impulses, the underlying reasons will never come up. So when we will hold gratification, then sooner or later the analysant will start sharing those unconscious mechanisms also. Another part of this analytic framework is, again I said that I am discussing what has to be done from the therapist part. So maintaining an attitude of neutrality and ambiguity is also part of this maintaining analytic framework. Maintaining neutrality here means that as a therapist, I do not take the side of the client. I do not support the ideas of the client. So I am reading it. Neutrality means that analyst does not take the side of the client in his her struggle. Thus, analyst does not either agree or disagree with the client's feelings towards the significant others in his her life, and do not take a position on what the client should do in his her life. So in a few words, what you will say, that the analyst remains non-judgmental. No inference or judgment is done about, okay, this is good, that is bad, okay, I can understand. So he remains or maintains a non-judgmental attitude, and that is called neutrality. So neither positive nor negative, that is neutral. But this neutrality does not mean that I am neutral towards the client. It means I do not care the client. The analyst definitely cares about the clients. Therefore, he is spending his her time with the client. But he has not to show it. He has not to express it. When I will not express that I am caring you, I am very much concerned with you, many therapies require this. But psychoanalysis say no, this is not required in this therapy. Why? To maintain the analytic framework. Why analytic framework is maintained? To help the unconscious material come to the surface. Okay? And the second part is maintaining ambiguity. And this means that as a therapist, as an analyst, we have not to express our own concerns, our own feelings in the therapy session. I will not say anything about me that I am this, I am a very good therapist, I have treated 200 cases, all these things. Therefore, for the client, I will remain ambiguous. And then, why this ambiguity is required? Why you see two or so many different things on Rosa card? Because the card itself is ambiguous. Nothing is made on it is ink blot. It is ambiguous, but you start projecting all the things. In the same way, when the therapist will remain ambiguous for the client, it will facilitate the projection of unconscious material. So should I read, or you have read this? Because in the video you can pause and read it. Moreover, this not sharing one's own viewpoints, one's own perspective, one's own ideas about oneself is maintaining ambiguity. And it permits the client, as I have said, to project their unconscious. When we will maintain, then it will help to project the unconscious feelings and thoughts on the analyst, and thus will facilitate the development of transference and transference neurosis. So thank you very much. Today I am ending here, and we will meet soon in the next class.